Hello everyone, I'm Dave Selwyn. It's just gone 12 midday, so good afternoon to you all and welcome to today's team brief. This is my last team brief, but I'd like to give a very warm Sherwood welcome to our new Chief Executive, John, who spookily has joined us on screen. John, very warm welcome to the organisation. So look, you've been here day 2. What's your first impressions? How was the car parking?
Thank you. Well, first of all, I parked in the patient car park by accident, but it's been all right so far. Been getting on site early, but I do recognise the challenges of car parking every day. Thank you, everyone, for the warm welcome. Thank you for joining today. It's a pleasure to be here. It's a privilege to be here, and thank you, Dave, for the welcome as well.
And you've sent around a bit of communication that quite a few people will have seen, and that's sort of setting out your stall for your first sort of 100 days. That's the sort of traditional thing. So just give us a bit of a flavour of what you hope to sort of do in that first 100 days or so.
Yeah, thanks. So hopefully people have had the chance to read, but if not, I'll be simple about it. So first is I'm here to listen. I'm here to help everybody else in doing their jobs, and I want to get out and about. I want to meet people. I want to understand our challenges, our opportunities, and how I can help people doing their jobs. I'm very clear that first and foremost, my job is to help people do their jobs and to help patients and colleagues and everything else therein. And so that's number one for me. Number two, of course, look, we've got to deliver our plan because that's about patient care, it's about safety, quality, and access. And of course, it's about making sure we spend money in the best possible way as well. But thirdly, we've got to make sure we've got an eye on the future. I think the platform Sherwood Forest has is an incredible one. To be at the forefront of the improvement and the change, which clearly the NHS needs in some areas. We've talked about digital transformation, we've talked about service transformation and otherwise, and we do have to have an eye on the future about what we need to do as an organisation in regards with that challenge as well. So those three things of listening, making sure we deliver our plan this year, but also making sure we've got a plan for delivering improvement in the future as well, I think is fundamental. I've said to everyone I've met so far, though, and the most fundamental thing for me is that culture is number one. Clearly, you've built an amazing culture here at Sherwood Forest, and how we build upon that culture, I think then everything else comes from that, be that quality, safety, access, good use of resources, and everything else therein.
That's great, and we'll put that. Hopefully, we'll put a link into that comms into the Q&A session so people can read that. So, John, just a little bird told me that you're a local lad. Is that true?
Well, I am a local lad. I was born and raised in around Woodthorpe and Arnold in the middle of, I guess, Mansfield and Nottingham city centre. So yeah, absolutely. I left for a while. I went to university in the Midlands and then worked in London for a little bit. But it was a privilege 4 or 5 years ago to move back to Nottingham, and yeah, that is absolutely true.
Oh, that's great. And I think if I've got this right, you had a bit of a confession in that that comms you sent round. You said that, is this true that you support some strange team down the road? You don't support our local team.
Well, I did really question whether to put this in the comms of it's a key part of my and my kids and my family's identity, but I'm also conscious it's probably a bit of a contentious one up here. But yeah, I was born and raised a Nottingham Forest fan, and that's what my dad and my mum told me to support. In fact, they said you can be whatever you want when you grow up, as long as you're a Forest fan. So here I am, and
Well,
I am
we'll
sadly carrying on that trend of misery for my children as well.
well, maybe we'll take you to the Stags ground and see if we can convert you. Okay, I'm going to shut up there. I'm going to hand over now to John. Step back in and just gently sit here.
Thank you so much, Dave. Before you do, actually, Dave, a couple of questions I wanted to ask you, just to keep you on your toes, if I may. So you've been an amazing colleague, been amazing support to me. Can I ask you three questions, please? I think it's going to be three, it might be more. One, what are you most proud of about your time at Sherwood Forest?
Um, So I've been here in 6.5, 7 years or so, and I think Sherwood was quite a different place when I came in. And I think it's changed quite a lot in that time. Particularly, obviously, we had the pandemic during all of that. What am I most proud about? I think I think that sort of raising the profile of Sherwood, raising the voice of Sherwood, and some of that is around um, the leadership and the clinical voice that we've now got, which I think is much stronger. It's much stronger across the organisation. It's also much stronger across our healthcare system, and I think that that's probably one of the things that I'm most proud about. We've obviously built some great things, and it's nice to walk around and see some of the work that's gone off. Whether that's the community diagnostic hub that's happening on the down at the Mansfield Community Hospital, or whether it's the theatres and some of the work we've done at Newark, and also some of the work we're doing here. If you walk around, there's a lot of change, but I think probably it's about raising the profile of Sherwood.
Thanks, Dave. Absolutely agree with that. And what's the best thing about Sherwood Forest?
Well, you said it. The people and the culture. I came from an organisation where you walk down the corridor and nobody spoke to you. Had to head down and sort of shuffle past. I came to Sherwood and I was very confused because in the first time I walked down the corridor, about 6 people said, "Hello, how are you?" And then sort of wanted me to give an answer, and I was just very unusual to that. And it's continued in that way. It's been such a friendly organisation. It's been a great organisation. I love the people here. Made some great friends, and it's been a real privilege to be here. One of the things I did very early days when I worked here was I sent a bit of a grumpy email, and someone came into my office and said, "Dave, that doesn't really work at Sherwood. Go and talk to them."
That's brilliant. Thank you. And again, I saw that yesterday on my first day here walking through the corridors, and not a word of a lie. There were 3 people before I'd found my way that had said, "How are you? Good morning," etc., etc. Granted, it took me half an hour to find my way, but that's a different point. And what next for you, Dave?
Um, Well, I'm going to take a bit. So I think my last day is next week, next Thursday. So I'm going to take a bit of time, sort of bit of time to sort of gather my thoughts a bit. I thought one of the things that I would probably do is say to my family that for the first time for 40 or 41 years, I might spend the whole of Christmas and New Year at home with them and not come into a hospital or be on call or all those sort of things, which is a bit of a surprise. So I'm just going to see what happens. To be honest with you, I don't have an immediate plans. I've got a bit of cycling, a bit of bike touring I'm going to do. I've got a bit of climbing that I'm going to go and do, a bit of skiing lined up. So I've got a few of those sort of things, but see how things go.
Thank you, Dave. Well, you've done an amazing job, and thank you. I'll let you go off screen now, as you said a few minutes ago as well. But thank you for humouring me there. So just a little bit from me before we go on to the agenda. I stress again, I'm really proud and privileged to be here to work alongside you all. And as I said, culture is number one for me. You've created a fantastic culture here, and it's the thing we must build upon to achieve on all of the opportunities and challenges we're facing. On a personal level, and hopefully this came through in your comms and anyone that's met me so far, I'm a very simple person. I want to be open, honest, accessible to you all. If you ever want to know anything from me, please get in touch. You've got my phone number, you've got my email, you know where my office is, I hope. Please do get in touch with me, and I'll tell you everything I know at that time. It's fundamental for me that I'll treat people equally. And again, I'll say hello as we walk down the corridor, and I'd ask that you do the same to me. Please, if I've said I'll do something for you, ask me if there's a problem with it. Get in touch if you think there's an issue with what we're doing or decisions we're making or otherwise. And a key part of my job is to empower you all as individuals and teams to be able to make stuff happen. And so again, if you think we need to do something differently to that end, then please do get in touch. I've said to a few colleagues, it's a challenging operating environment at the moment across everything we're doing, but I do think there's a real optimism about what Sherwood Forest can do in the months and years to come. And we should have an ambition linked to that as well about what we can achieve as an organisation, because I think we're in an excellent position to build upon, again, the amazing work that you've all done as individuals and as teams over the past few years. So that's it at a high level from me. As ever with this agenda, I'd encourage you to put as many questions as you can in the chat. I know it's always tricky, but if you want to keep it anonymous as well, that's absolutely fine. We can do that. But the more questions, the better. From my perspective, please. We've got three brilliant presenters on today, and the more questions we have, the more powerful a discussion it will be. Three brief updates to me to begin with. So one is clocks have gone back, which I completely forgot when I was putting my kids to bed on Sunday night. I wondered why they were so tired. But let's keep our spirits up in and amongst that. We know that it'll be darker driving to and going home from work at times in and amongst that, and make sure you get some rest and breaks and some daylight during the day, please, in and amongst the environment we're in. Secondly, flu vaccinations. I think we're at around 32% of colleagues now vaccinated here at Sherwood Forest, which is real progress. And thank you for doing that. Please keep that up. We've got lots of clinics going on over the coming days. I've got a list here. The 29th of October, 9 to 11:30 at KTC Walkway, 30th, 9 to 11:30 at Mansfield Community Hospital Resource Room, and 31st, 1:30 to 3:30 at the KTC Walkway. Please do get vaccinated and encourage others to as well. Finally, staff survey. One of, if not the most important things for us to do every single year. We've had 1,732 colleagues, around 28% of our workforce, currently do their staff survey. We want that number to be much, much higher. Again, we know it's challenging. We know there's lots of great things going on too. We want to hear the truth of what it's like to work here at Sherwood Forest for everyone here. It's really, really important, this one. So please do complete your staff survey, and I'm very clear for our leadership teams and our management teams across the organisation, they need to give you time to be able to do it. It should be in your inbox. There'll be a paper copy in your department as well. Please do get in touch if you can't find it, and we will find a way to get the survey to you. Wonderful. If there aren't any questions on that, we've got the links gone in there. We're going to go on to our first presenter of the day. Sally, over to you for an infection prevention and control update, please.
Thank you, John. Afternoon, everybody. So I just wanted to come today and give you an update on IPC, where we are as we start winter. So the first reminder is around our winter viruses. So we are starting to see flu cases now. So currently today we've got 2 COVID cases and 7 flu cases within the trust at the moment. So we are starting to see those slight increases, and that's in line with the rest of the region who are seeing those increases now. So you can get respiratory virus testing. It is available through the lab. If you send a viral swab to the lab, they'll be able to do that for you. And patients coming into ED with respiratory virus symptoms can also be tested on point of care within ED as well. We have had our first norovirus outbreak of the season last week, so please be on the lookout for that. Any patients coming in with diarrhea and vomiting, please think norovirus and get those samples to the lab so we can contain that as early as possible and prevent us closing any wards where we can. There's quite a few different things happening now and going around. We are still seeing an increase in all of our other infections. So our C. diff rates are still quite high. We've had 3 MRSA bacteremias this year so far, and we are seeing that increase in other areas as well. It is following a regional and national trend, so all areas are seeing these increases. But it's key for us to ensure we're doing the right things to try and prevent as many of these infections as possible. We do know we've had some C. diff outbreaks where we've had cross-infection occur as well as an MRSA outbreak. So just a reminder of ensuring we're cleaning all of our equipment in between patients and before use. It's really key that we've got clean equipment. We're using our personal protective equipment where we should. So we've got our gloves and aprons and on. We're wearing masks for our respiratory patients. We're doing our hand hygiene with either soap and water or our gel. It's where we should as well. Please it's that we are looking at our antibiotic usage and maintaining our antimicrobial stewardship. Bare below the elbows has been something that's been high on the agenda recently. We have seen a lot of non-compliance with that. We've seen watchers. We've also seen a lot of nail varnish and things. So it's really important that we do stick to our policies where it's no watchers, it's one plain band ring. We are not wearing cardigans, jackets when we're doing patient care. That we have got no nail polish for direct patient facing staff. It's key that we keep to those and that we all actively take a part in making sure that if we are seeing these things happening, that we are challenging that, but in a respectful way, and we're speaking to staff in the right way and just letting them know that that's not our policies here. And we'd really appreciate that, 'cause infection prevention and control is everybody's responsibility. It's something we can all influence within, no matter what job role we do within the organisation, and we really appreciate your support in maintaining our patients' safety and reducing the risk of them getting an infection whilst they're with us. Thank you.
Thank you, Sally. Very clear. We have had a question through. Will we be restarting protocol-based swabbing this year, or is it based on clinical suspicion?
So it is based on clinical suspicion. The national guidance is for testing patients with respiratory virus symptoms, but also clinical diagnosis. If people feel that is the clinical diagnosis, the medical teams are able to request those swabs as well.
Cool. Thank you for the question. Thank you for that clear answer. Is there specific advice for those in non-patient facing services, please? And I'm saying this, I'm noting, as soon as you said, take your watches off, I've got my watch on screen.
Yes.
So
Yes, yeah. So in non-patient facing areas, then that's okay. But if we are in any clinical areas, so where any of our patients are, then we should all be adhering to bare below the elbow. So no watchers, no long sleeves, tuck in ties and lanyards and things in where we're going when we're going with patients. But yes, if you're in a non-clinical area, in an office area, it's okay to have your watch on. But if you are entering any clinical area, you should be removing them.
thank you. Very clear, Sally. If there are no other questions from colleagues, Sally, what's the final line you'd like to leave us with on IPC, please?
Remembering to clean our equipment and wash our hands, and using our PPE. It'll keep us safe.
Cracking stuff. Thank you for a very clear summary and really good questions as well, everyone. Agenda item 2 for today is Debbie with a workforce update, including Mars. Welcome,
Thanks,
Debbie.
John. Thank you, John. Afternoon, everybody. I hope everybody's well today. So just come along today, this afternoon, just again to give you a brief overview of the Mars, the mutually agreed resignation scheme that we relaunched and the window opened for applications last Monday, the 20th of October. So just really to recap, it's completely voluntary and this is for all non-patient facing roles of all bands, and what this does for the organisation but also for individuals is those who are potentially thinking of leaving, who want to bring forward their decisions, they can apply to leave via the mutually agreed resignation scheme in receipt of a special severance payment. This is a nationally agreed scheme, so in terms of payment it's up to a maximum of 12 months salary depending on length of service, but that is capped at 80k. And as I say, it's the mutually agreed resignation scheme is to support us as a trust to achieve our efficiencies, not just from a financial perspective, but allows us to transact transformations, and it does not include redundancy. So In terms of the support available for individuals, recognise that there's a lot of information regarding the mutually agreed resignation scheme. A number of drop-in sessions have been held. There is a further one on the 5th of November, but there is a full list of frequently asked questions on the intranet page, and we also have a dedicated email page for individuals to ask any personal questions that they may have to Mars. So I think the take-home message, John, is the window is open until Monday, the 10th of November. Individuals who want to apply for the scheme need to submit their applications to their line manager by Monday the 10th. Managers then need to submit the completed application to the Mars inbox by the 13th of November. And then the Mars panel will take place on the 21st of November, with individuals receiving decisions the week after as to whether their application has been supported or not. Like last time, if individuals are supported in terms of their application, then the process in terms of receiving independent legal advice and the signing of a settlement agreement will support individuals through that. Just wanted the opportunity to come back today just to go through the timescales again and give a bit of a high level overview of the Mars scheme. So I'll leave it there.
Thank you, Debbie. I think that's very clear. If people have got questions, again, please do put them in the chat and we'll make sure we get them answered. Again, if you don't want to ask them in front of everybody here, please get in touch with, I'm going to say Debbie, get in touch with Debbie and the wider team, and we'll make sure they're answered. I know this is always a sensitive topic, quite rightly so. As I say, it's completely voluntary. If it's the right thing for you to consider it, then please consider it. As I say, it's a completely voluntary process, and again, there's support for you there if you need to discuss with anyone. I don't think we have any questions there, or indeed people might want to go to the drop-in sessions to cover those. So we will leave it there on Mars and a workforce update. Again, I'm sure Debbie, if she had any more time, would say please complete your staff survey.
Absolutely, and get your flu vaccine as well.
Cracking, thank you. How could I have missed that? Thirdly then, and the last item of today, Jim, Improvement Week. Over to you. Thank you for joining.
No, thank you, John, and welcome to Sherwood. Afternoon all. Hope everybody is doing okay today. So I'm just here today to remind colleagues that next week is our second annual Improvement Week. And Improvement Week is an opportunity for the Trust to celebrate the progress we've made with regards improvement, and to shine a light on how improvement happens every day across our services. It's essentially a week-long series of events and drop-in sessions for people to find out more, possibly develop their skills, or even if you're just curious about what improvement means and how you can get involved, there's a little bit of something for everyone. We have been very conscious that the organisation is really busy at the moment, and colleagues may not get the opportunity to take part perhaps in the way that they would. So a lot of the content during the week will be pre-recorded and will be available to view when convenient. But there will be some drop-in sessions and some in-person sessions. So if okay, John, I just wanted to flag a few examples of some of the key events that are happening next week. I do hasten to say that there is an online brochure. We published it via the bulletin last week, but I think Olivia is going to drop it into the chat. It's a sway, which just gives you an overview of some of the things that's happening. There's also a couple of links on there as well for some of the in-person events for people to book onto. And it's not that we're expecting an overwhelming demand for some of the in-person events. It's just to avoid two people turning up at the same time wanting to find out. So you can book a bit of a time slot with the individuals who are available. So some of the highlights of the week. So on Monday will be the opening of Improvement Week, which in itself will be quite exciting. In the library between 10 and 11, colleagues have an opportunity to speak with Simon and Laura from the Improvement Faculty to find out about the Insights Improvement Tool. I don't want to over-egg this, but I've been fairly clear about my own views about the Insights Improvement Tool. It is about as good as I've ever seen. It provides a host of information across a number of different metrics, including operational performance and finance. and importantly includes a lot of benchmarking data. It's an opportunity for you to come and find out about your own service, how we compare well, how we don't compare, areas for improvement and such like. It really is, I think, a bit of a game changer. So there's an opportunity between 10 and 11 to find out more. Between 12:30 and 2, also in the library, there'll be an opportunity to speak with Vicky and Natalie from the faculty around improvement coaching conversations. And if you're in the library or happen to be passing the library all week, why not have a look at the case study displays that'll be up on the wall there. Some absolutely fantastic examples of improvement work that's happened on a large scale basis, on a very small scale basis, but significant nonetheless. On Tuesday, we'll repeat the same session, so between 10 and 11:30, Chloe and Mitchell will be available in the library to talk about improvement coaching, and between 12:30 and 1:30, Simon and Louise will be available again for the Insights tool. Throughout the week, we'll also be dropping bite-sized training via the intranet, and there'll also be links available in comms for people to access this. And these are for all levels of ability and skill. But the sort of things that they'll cover is how to write an improvement aim, how to construct a driver diagram, how to design a poster, and there'll be other subjects as well. So they'll be dropping throughout the week. On Wednesday, the focus will be on Newark. So we'll be in Newark all day. So a small team will be available at Newark. We'll be in the training room in level 1. Please do drop in if there's anything you want to discuss, any improvement project that you want some help and assistance with, or again, if you're just curious about what improvement means and how you can get involved, drop in and see us on Wednesday. We would love to see you. On Thursday, we have our showcase event. Something that we piloted earlier on in the year, which is an opportunity for individuals to showcase some of their improvement work. So there'll be a number of different examples all across the trust with lots of individuals. And so come down to the KTC between about 1:30 and 3, and you can come and see some examples of improvement work that's taken place. We are also delivering this in collaboration with our colleagues in research and innovation, so there'll be some examples of research work that's been undertaken as well, obviously acknowledging the inextricable link between the two. So please do come down if you get a chance. And on Friday, we'll be repeating the Insight session between 10 and 11 in the library, so Simon and Louise will be available, and then between 12:30 and 2, Anne and Katie will be available to help you with coaching conversations. So that's a bit of an overview, some of the highlights of the week. Like I say, all resources will be shared throughout the week via our intranet pages, and there will also be links will be circulated via our newsletter. Now, of course, John, improvement never stops. I know that sounds a bit of a cliche, but I think there's some truth in that. Just because we're celebrating a week long of some of the amazing improvement work that happens, improvement will just keep on going and should keep on going. So if you're not able to get to any of the sessions and perhaps are finding it difficult to access some of the online material, why don't you just come in and pop in and see us? We would love to see you. The Improvement Faculty Office, we recently moved. We're now based just behind the library in what was previously the Flexible Learning Room. So pop in if there's any help or advice that you need. Or again, I know I keep saying this, but if you're just curious, if you just want to find out more about what improvement means and what it means to you, or of course, if you just fancy a cup of tea and a bit of a break, either way, we would love to see you. Just pop in at any point. So I look forward to seeing as many of you as possible next week. Do get in contact if there is anything specific you want to see or any questions at all, and we would love to hear from you. Thank you, John.
Thank you, Jim. Very clear update. Are there any, we've had a question in, sorry, I'm going between what I was going to ask you and a question I've just seen on the board. Are all the sessions available for everyone? Please.
Yeah, they are. Yeah, and I should have said as well, and apologies for my oversight, but the Improvement Insights tool that we've developed is accessible to absolutely everybody. There is no limitation, no restrictions, there's no professional groupings or anything like that. All sessions are available to everyone in the organisation, and the Insights tool as well is accessible to everybody as well. Yeah, everybody's welcome.
Thank you. And in a headline, in 1 or 2 lines, can you give us an example of the type of project which you and your team get involved in?
Yeah, so I Well, perhaps if I answer it in the context of Improvement Week, John, might help. So the showcase event, for example, that's happening next Thursday down in the KTC. Some of the stands and some of the store holders will range from there's a stall looking at the CDC, so an opportunity for individuals to have a look at the latest stage of the CDC, how that's coming along, and I think there's a small video that will be circulated. Will be on a cycle as well, so you can have a look at the artist's impression, which is really exciting. So that's an example of obviously large-scale transformational work. But some of our colleagues from various wards will also be there as well, displaying some of the work that they've done as part of the ward accreditation process. We'll also have a stall as well, which will focus on the WAVE process, which is a rapid improvement model that we've recently introduced in the organisation. We've just done that with the diabetes and endocrinology service, and the pilot is almost complete, so there'll be opportunity to find out a little bit more about that. And then some of the examples of the research. So we have Raphael, one of our consultant gynecologists, is coming to talk about a piece of research work that is undertaken. In terms of the case studies, John, which will be displayed on the library, some fantastic examples of improvement work at all different levels of the organisation. So there'll be a case study around some work that a couple of colleagues, Rachel Williams and Sarah Hodgkinson, has done around paediatrics diabetes management. And that was focused on their approach to embracing technology and using national data. There will be a display around a piece of work around antenatal and postnatal care, a piece of work undertaken by colleague Morgan Lowe, and that was around the application of creative thinking and the use of evidence. And then we've actually got a case study as well involving two of our housekeepers as well, Tina Hindley and Tracy, who did some brilliant work around recycling practices and introducing better processes to help with segregation. So a genuine cross-section of improvement work, which hopefully illustrates that improvement really is for everybody to get involved in. It's not exclusive. Everybody can do improvement day to day in their roles, regardless of what role they play.
Thank you, Jim. Very clear. So I'm clear that driving improvement is fundamental to where we need to get to as an NHS and as an organisation. So please do engage with this. It doesn't all need to be the formal stuff. We want everyone, well, I want everyone in the organisation to feel like they can drive improvement in their area. Simple as that. And again, part of my job is to making sure people feel that they can drive change and improvement in their areas, and where they need help to do it, be it myself, Jim, or other colleagues, we can provide you with that help. Final line from me before I come to Jim for his final line to summarise. If you've got an improvement that you want to share, you need help with, or you want to put on Team Brief or otherwise, please get in touch. Feel free to get in touch with me directly. I think the more we can share what amazing work's going on across the organisation, the better. Jim, final word.
Yeah, thanks, John. And I couldn't agree more with your summary of what improvement means to this organisation. It genuinely is everybody's role. Yes, me and my team are there to help and advise and support where we can, but we want everybody to get involved in this. We want everybody to come to work and to be curious, to think, can I do my job better? And if I can do my job better, how do I go about doing that? We want people to be empowered and to have a go at making improvements in their areas of work. And if we can do that and just do that alone, I think we will have achieved massive amounts, but there's clearly so much more we can do. So yeah, look forward to seeing people next week.
Great, thank you, Jim. The final, well, I think final, please do fire in any questions in the final couple of minutes before we close. Question is one which is coming for me, which is, what am I most looking forward to in my new role at Sherwood Forest? So first, for me, it's a privilege to work in the NHS. The thing that gets me out of bed every morning is helping people, colleagues, patients, communities. That's the thing that makes the NHS so special for me. Now, to have the opportunity to do that at Sherwood Forest is something I really don't underestimate, and it's a responsibility I take very seriously. I'm very, very proud to be here, and I'll do everything I can to help you as colleagues, patients, communities, to get what they need going forward, and to make sure that Sherwood Forest is a great place to work and a great place to receive care, and hopefully to play my part alongside you all. So that's what I'm looking forward to. As I say, to get out of bed every morning to try and make a difference in the NHS is a privilege. To do that at Sherwood Forest, I'm so proud. So thank you. I hope that answers your question. I hope we've answered all the questions you've fired in today. Thank you for doing so. Thank you for turning up. if there are no further questions, final line from me. On a personal level, thank you for the welcome. More broadly, thank you for everything you're doing. I recognise how challenging it is. You are making a difference. Please don't forget that. I'll say many times, like all of us, we'll drive, walk, get the bus home, and we'll think about all the things we've got to do. We'll spend less time thinking about all the things we've got done, but what I can assure you is you're all making a difference to patients and colleagues across Sherwood Forest. So thank you for what you're doing, and I look forward to seeing you around. Have a good day, everyone.